Dr. Diana Ramos, California's Surgeon General, who was recently appointed by Governor Newsom this year. In this unique role, she advises the governor on how best to address public health risks and challenges as effectively and early as possible. Dr. Ramos is an expert in public health, reproductive health, and health tech, and she serves as the public health administrator at the California Department of Public Health Center for Healthy Communities. She's also served on the faculty of the University of Southern California's Keck School of Medicine since 1999, and if she needs any more accolades, she is also the per diem physician at Kaiser, the founder and CEO of Gamify Health, and holds many other posts. Wow. It sort of puts me to shame. So welcome. It's an honor to have you with us. And please. Thank you so much.
All right. Good morning, everyone. Buenos dias. My name is Dr. Diana Ramos, and I am the new California Surgeon General. I was sworn in on September 1st. So I really am just like recently in the position. And I really appreciate Dr. Doty's experience sharing, and it really is very grounding because that is really what we all need. I am thrilled to be here. This is the forum that I have dreamed about being a part of, being able to share our medical experiences with what we can do in government and what we can do with innovation. That was one of my questions that I asked the governor's office is, where is tech here? Where is tech in public health, in healthcare in California? Because we are the leaders, I think, and I'll be humble, of the world when it comes to technology. This is Silicon Valley, and this is where innovation happens, and we have the best resources in California. So that was my question, and here I am. So I am thrilled to be part of this session here today, and I look forward to continuing the relationship going forward for a long time. But I want to share something, start out with making it real. And oftentimes, and I know I've worked with researchers in the lab, I've worked with tech people, but sometimes we forget, why are we doing this? And I want to share a story of a patient that really stood out in my mind, and I carry on with my career since I met her. And that is a patient that I saw when I was practicing in East Los Angeles. I'm an obstetrician gynecologist by training. And she, I could tell, was depressed, did the Edinburgh questionnaire, confirmed it, but she had a very flat affect. She was pregnant, and she had a toddler, about 2 years old, and he was disheveled and had a bag of chips. This was about 9 o'clock in the morning, and he had his soda. And I thought, oh my goodness, okay, we have some work to do here, but that's okay. She's there. She's seeing me in the office. That was the first big accomplishment, and I couldn't forget that. So in talking to her and listening to her, going back to Dr. Doty's point, having that conversation, being that voice, I was able, over the following months, I actually started her on medication. And when I remember seeing her a couple of months later, she said, Dr. Ramos, my husband thanks you. I said, your husband? Why your husband? And she said, because you have changed our family. You have changed our family. And I saw her, now she had makeup. She was nicely groomed. The little boy had a book. He was groomed. And she said, our family is so much happier. And I want to remind us that mental health is not just the one person that is in front of us. It's the whole ripple effect. And with mental health, it is a whole family and community impact. So it is so critically important that we don't forget impact that all of this work has. And I can tell you, in the Latino community, which is, I'm Mexican American, that I grew up in, you don't talk about mental health. So when you're creating all of this amazing innovation, keep in mind that culture is so critically important. And looking back on my family, my cousin actually is a psychologist, and she says, you know how our aunt we used to say she was very nervous. You know how this other aunt we used to say that she just didn't like to interact with people? Well, they were depressed. And I thought, whoa, what, really? And so she would go through and she would delineate all the diagnoses and justify why. And I thought, you're right. You're right. And so we have to take that into consideration. And not only the culture, but the language. Being able to deliver the messaging, the tools in the language that our targeted audience can understand, and the literacy level. So that's why I think technology can really be that bridge and break down some of the segmentation and inability to provide care for people all over California and beyond. So with mental health being so critically important, personally to me, we're going to be continuing, my office is going to be continuing the work on ACEs, because we know ACEs can set that trajectory for negative impact for lifelong health, whether it's diabetes, high blood pressure, obesity, I mean, all of these negative impacts. So continuing the great work that was started on ACEs, and then more importantly, focusing on mental health. In California, I don't know if you all realize, but there is a 4.7 billion with a B investment in mental health, specifically focusing on youth. When I was told the number of 4.7 billion, they said, for you to understand how much money this is, that is more than the budget for healthcare in 8 states in the United States. That is a huge investment. And I already know all the entrepreneurs and tech companies, how do we get access to some of that 4.7 billion, right? I would probably be thinking that. There's a whole process, and that's a separate conversation. But just know that investment is there, 4.7 billion. Our office specifically is actually going to be developing a media campaign. We have $24 million to really reach out and increase awareness on ACEs, on what can be done, what resources are available. Because along with the $4.7 billion in investments in mental health, there is also a 40,000 workforce increase. So there is a commitment already there. So we in California are leading the nation in realizing, and not just realizing, but investing in solutions for healthcare. So I am very proud to be part of that leadership. And this is critically important because the resources go up to age 20. So when I started to look at all of our data and the work that's being done, I thought, wow, nobody's really talking about the college age kids. And I was at a meeting, and one of my colleagues who works at USC, the Student Health Center, she said, yeah, we already are doing ACEs screening with our college students. And I thought, wow, this is fantastic, because we know that 75% of all mental health issues are going to be arising by age 24. So if we can catch it when the kids are here, we're at Stanford in college, right? Nobody is immune. Nobody is immune. As Dr. Doty pointed out, everybody has, unfortunately, mental health is universal. It does not discriminate based on economics or ethnic background. So if we can reach out to that population of our future, that is incredible, because we also know that the highest unintended pregnancy rates are in those college age kids. The highest STD rates are in the college age kids. So I thought, wow, what a wonderful opportunity so that we can really focus on college age kids, because now we can not only do some ACEs screening, and we can actually provide the resources because they're still covered. They're still covered, and hopefully we can identify those protective factors that Dr. Doty had highlighted. And that's what I would challenge all of you to do. And I'm challenging the researchers at UCSF and UCLA who are working with us. What are the protective factors that are evidence-based that we can expose our kids to even more and more to help off balance all of the negative ACEs effects that there are? Because we know that you can break that trajectory with enough positive experiences. But I haven't seen that data. So I'm pushing. I said, I want to know what can we do? What can we promote? Because it's not just a matter of doing the same thing over and over again, right? What are we going to get? The same result. We need to do something different. So we're focusing on mental health. And the other piece too that my office is focusing on is reproductive health. As an obstetrician gynecologist, I would be remiss not to take the opportunity to really lead reproductive health in California. And by that, I mean focusing on the reproductive rights that are here in California, and more importantly, focusing on perinatal mental, not only mental health, but perinatal mental health outcomes. So how can we decrease the preterm birth rates? I mean, we're here at Stanford, and I've worked with a lot of researchers at Stanford for the preterm birth. So you all have an amazing preterm birth center and innovative research that's happening. So how can we decrease that? Because we know California has the lowest maternal mortality rate in the country, but we still have a lot of work to do when it comes to Black maternal mortality rate. We have a lot of work to do. And so with that, focusing on mental health, reproductive health, and obviously we're in California, taking equity into consideration. Because without all of the consideration into equity, it's a moot point. In California, 40% of the population is Hispanic, 40%. But yet we don't oftentimes realize the power that not only economically, but influencing and politically that the Hispanic population can bring. So elevating them, doing a lot of your innovative testing, innovative research with the Hispanic population, I would highly encourage you, to take that into consideration. So with that, I thank you for the opportunity to speak to all of you. And as the charge on the email said, let's all work together to create a healthcare of the future that is unstoppable. What can you do if nothing was impossible? So thank you for the opportunity.